A bold move that could endanger our children's future. The White House's plan to undo a crucial EPA rule. Last month, the Trump administration launched a controversial effort to overturn a landmark 2009 scientific determination. The very foundation on which the Environmental Protection Agency, EPA, has based its regulations to control greenhouse gas emissions under the Clean Air Act. But here's where it gets controversial. If this proposal becomes official, it's almost guaranteed to face legal challenges in court. Experts warn that if the administration's push is successful, the health of millions of Americans could be at serious risk, with children being disproportionately affected. Pediatrician Debra Hendrickson, a clinical professor at the University of Nevada School of Medicine, and the author of The Air They Breathe, a pediatrician on the front lines of climate change, weighs in on the stakes involved. What happens if this critical finding is revoked? How will it affect the well-being of Americans, particularly our children? Dr. Hendrickson explains, revoking this scientific conclusion would dismantle a central pillar in the battle against worsening climate-related threats, like wildfires, increasing heat waves, and devastating floods and hurricanes. These challenges have escalated over the past 2 decades, and without regulatory safeguards, are very likely to become even more severe. Failing to prevent this rollback amounts to a grave injustice toward children. Not only will they inherit a world that is hotter, more unstable, and more dangerous, but they are already the most vulnerable to these mounting health threats. We are witnessing rising air pollution, more frequent and intense heat episodes, and the psychological and physical trauma that comes with natural disasters. Sadly, the hard-earned improvements in infant mortality and children's overall health seen over the last century are now at risk of being undone. Why are children, especially those under 5, so much more at risk? The reasons are both scientific and straightforward. First, children's physiology is fundamentally different. In pediatrics, it's often said that children are not simply small adults, because you cannot apply adult-based medical calculations or assumptions to a young child and expect accurate results or care. Second, their smaller size means that relative to their body weight, they inhale more air and therefore more pollutants than adults do. Third, and perhaps most importantly, their organs and bodily systems are still developing. This makes them particularly susceptible to being disrupted or damaged by exposure to environmental toxins and harmful pollutants. For example, take a city like Reno, which frequently becomes shrouded in smoke during wildfire season. But baby or toddler living there breathes more rapidly than an adult, taking in a greater proportion of polluted air. Since their lungs and brains are in critical stages of development, this exposure can cause lasting harm. What happens when these smoke waves roll in? How do they impact our children's daily lives? Dr. Hendrickson shares that when major fires break out in California, Reno often finds itself directly downwind, just about 10 miles from the border, meaning it gets hit hard by the toxic smoke. During these times, pediatric clinics and hospitals become overwhelmed with kids suffering from coughing, wheezing, and respiratory distress. During periods of extreme heat, which often precede these fires because heat sparks the blazes, pediatric wards fill with children requiring oxygen. It's common to see children fainting during sports practices due to the combined stress of heat and poor air quality. Studies back up these observations. Pediatric emergency room visits spike by 17% during heat waves, and asthma-related visits soar by as much as 78% during intense smoke events, such as the Camp Fire in 2018. These episodes don't just impact children's immediate health. Because they affect developing organs and systems, the damage can echo throughout a child's lifetime. So what does this mean for our future? Should governments weaken protections that have demonstrably helped shield us from these mounting dangers? Or should we double down on science-driven policies for the sake of our children's health and the planet's well-being? This debate isn't just political. It hits at the heart of our collective responsibility to future generations. What are your thoughts? Is this proposal a necessary rollback or a dangerous gamble with our children's health? Share your views below. This is a conversation we all need to have.